Thank you, Louise. Welcome again, everyone. So I'm going to talk a little bit about my project itself, just to give you an insight to what it is. So the aim of my project when I first started out was to explore the scale and use of paper-based nursing assessments across NHS and social care-based hospices. So basically an insight into the documentation gaps, the variation in terminology, but also explore the usability of electronic information systems where available, because we know that not every single setting has an electronic information system, but look at where the opportunities, the challenges, but also understand where the pain points, including the barriers that limit the use of healthcare, digital health technologies, but also the ability to join up information across systems in order to improve patient care, safety, and standards. So hopefully towards the end of my Topol project, the aim would be to inform a much bigger and currently active program at NHSX on the development of standards of the nursing assessments terminology to make sure, to ensure there's a consistency in the way that we collect, record, and communicate digital information. It is a basic requirement for the effective real life and real time patient information, and also sharing that across social care systems. So when I think back to my decision and why I applied for to go on the Topol Fellowship program, this was actually as a direct result of my experience as a return to practice nurse. So in January 2020, 2 months before COVID, I decided, and after several years of working away in the private sector, decided to enroll on a 6-month return to practice nursing program at the University of Hertfordshire, and I chose a hospice setting. And the reason why I chose this setting was because even though I'd led multiple clinical information system deployments across community and mental health settings, I really didn't know much about hospices, and it just sort of felt like a hidden area and profession for me. So naively, I had a lot of assumptions going into the hospice. Coming from the private sector, I thought I would go into a hospice and it would be one of those state-of-art, cutting-edge sort of digital health tech, all singing and dancing, but I think I was very wrong. And that was very naive of me. And what I observed in my first few weeks was the length of time that it took to check stocked controlled medicines, the time spent updating the whiteboard. But I think there was a particular one area that stood out to me, and that was the nursing assessment paper forms that we use. So in a single patient admission, I observed approximately 15 to 20, or sometimes more, paper-based assessments used per patient and one admission. And what was more alarming was nurses routinely stayed behind for approximately an hour to 2 hours after a grueling a 7 or 10 hour shift to manually transfer the information from paper-based assessment forms into a clinical system, and in some cases with very different formats. So I observed that the barriers and differences in documentation, the ways of working, but also information sharing practices across the environment, but also the impact on the impact on patient care in terms of, it's delayed and it's not coordinated, it's not accessible or available in a timely manner across the MDT healthcare professionals and also agencies. So the ambition of my work on Topol is really to support and further inform standardization and digitization to improve the standards of documentation. So by doing that, we're reducing the burden on our clinicians, we're freeing up and giving nurses time back to really care for the patients, which is what the job is in the first place. And when I look back, because during the pandemic, yes, the pandemic has helped to speed up the use of digital tools and solutions and systems on the front line, but I don't think we're going to be able to truly harness the power of digital health and tech and big data without the standardization of nursing assessment terminology. That is what and how we collect data across the systems to ensure that we have that improved information flow across the systems. So just going, I'm conscious of time, but just going into Topol itself, and people always ask me, why have I choose the Topol, and there are other fellowships, why have I gone specifically for Topol? And for me, I think the answer is quite simple. My career hasn't taken a traditional route at all, so I suppose for me it's no exception. But going for Topol is no exception. But I think, where else are you going to get an opportunity to work alongside SMEs and a very diverse group of amazing clinical staff? So doctors, nurses, allied healthcare professionals, dentists, scientists, pharmacists, opticians who are looking to shape and accelerate the NHS digital health revolution. So, and yes, of course, like any other program that I apply to go on, I look for diversity of professions, background, and also ethnicity. I think the art and the power of what's possible really lies in our diversity of thoughts and perspectives. So a key factor for me applying is that I needed to, when I went onto the website and wanted to apply for this, is do I have someone that looks like me? Thankfully, there was one a lady called Roxanne Crosby in Willoughby, who's an amazing, she was on cohort 1, and I saw her and I'm thinking, oh my gosh, okay. So that was one of the key factors one of the key reasons why I actually applied. And she has been amazing. She's just won and her team and her won an award recently in the Nursing Times. But I think saying that, there is one glaring, I think, visible gap from my perspective. And I think it is diverse, but I think there is one particular group that is very underrepresented, and I think that's the absence of Black men and Black clinicians. And I know that in the NHS we have an abundance and exceptional groups of Black clinical healthcare professionals in the NHS, but for some reason we have zero representation on cohort 1 and 2. So it is my hope that we get more applications from our Black men who are clinicians, but also from Black women and also other ethnic minorities, because I think we have a real opportunity now to lead and effect systemic and sustainable change by doing things like imagining the care pathways, the workflows, the ways of working across a sort of a broader health and care spectrum of professions and organizations, including the ICSs, but also internationally. So for me, I think it was a no-brainer. It had to be Topol. The application process, as for me, was pretty straightforward. I would say take your time, think very carefully through what you're planning to do. You don't need to have all the answers. The Topol doesn't expect you to have all the answers, but be clear in your head what is it, what problem you're trying to address in the first place, and also make sure you get the application form in on time. If you can, like I did, walk through your proposed project with colleagues or friends, and it just gives you that sort of sense check when you put in your application. Make sure that you have an executive sponsor who can, they'll be invaluable, providing support when needed, including help you to progress the project successfully, but also unlock doors and blockers. My executive sponsor was Dr. Natasha Phillips, who is my boss. She's a Chief National Information Officer for NHS England, but also Director of Safety at NHSX. But also the Topol team in-house, I call them the Topol Care team on tap. They have been incredibly amazing, sort of taking us through, providing help and guidance when and whenever we need it, really. So they've been an incredible support all the way through. So I couldn't fault them. It's been exceptional. And then the opportunities in Topol are simply endless for me. I think it gives you time is something that we talk about as clinicians in the NHS. There isn't time to really sit down to really think creatively about solution or sort of about a problem and how to solve it. So you have, with Topol Fellowship, you have the time to address a specific problem and sort of analyze and explore the hypothesis and everything. But also being in the Topol cohort 2, it's given me friends for life. It's more of a Topol community. I have friends that I've made in cohort 1 and also cohort 2, and hopefully would expect to make to join the community of cohort 3 and 4, and hopefully looking to see you there. Again, you did develop and expand on your digital expertise. skills and knowledge, which is really required in the landscape that we live in today to lead innovation and bring about that national change as a digital champion. But I think for me, it was really interesting. I think what I really liked was the fact that we had access to subject matter experts. So I know Louise spoke about the Agile. For those who are not used to working in an Agile, using Agile methodology, this is a great introduction to Agile for you. Stakeholder management, identification, mapping, delivery, introduction to things like design thinking, impact measurement, and theories of change. And I think also discovery, learning learning by doing, and ideation. So it's just absolutely vast, and I can't sing its praises enough. As I said, I call it the Topol Care team. They're continuously available. They make themselves available to offer advice and support. And I definitely have found the drop-in sessions very invaluable to me, especially when I'm having a bit of a wobble, or something isn't going quite right on the project. Then that they have all these weekly drop-in sessions that are just amazing. And also I had a survey during mine, and Topol was amazing. They even hosted my survey for me, and because I didn't know where to go to host it, and I didn't want to go on any bog standard survey. So, but I think it's also an opportunity to engage in learning. So it has the academic credibility that you need, and you would join that sort of growing community of digital leaders who are working systematically to improve, to use digital to improve health outcomes. Again, you'd have connections to national digital initiatives. So in many ways, you can support teams to work on digital health technologies. You can respond to service or system requests to learn what digital solutions are out there that can help manage demand. But also undertaking the fellowship, the Topol Fellowship, increases and expands your knowledge and skills of how to better address, build capacity, capabilities, across systems, including engagement across the multi-stakeholder organisation boundaries. And finally, I think it gives you the mental space and time to think thoroughly through the issues. So when I think about the Topol Fellowship, for me, it means access all areas, basically, because it opens doors for you, and sort of like you get in. One of the two things that I think that I miss in this particular cohort is COVID. Unfortunately, I was undertaking this during the COVID, so we really didn't get a chance to really see and meet each other face to face. But I think, although we didn't do that, I think Topol, the team, made sure that we had a lot of the webinars that we have now faced on visual and virtual meetings and discussions. So that was really, really helpful. What's next for me? So I'm going to continue to share my insights on my project nationally and internationally. It's actually this piece of work it's a lot bigger than I thought it would be, but it's interesting because it feeds into two key programs within NHSX, one which is of the standards of design and development for nursing terminologies, and the other one, which is a new commission that I'm working on, which is what good looks like for nursing from a digital transformation perspective. So hope to continue to represent Topol in a positive light, but also for me, I'm moving, my focus is around systems development, so working across the sort of multi-organisation executive level boundaries to build in a collaborative system-wide leadership thinking and practice, and hoping to support pan-sector teams working across organisation boundaries on very complex programmes relating to strategic ICS and digital priorities. And also lastly, continue to amplify the voice of BAME clinical healthcare professionals in digital health and increase representation. I don't think there's anything else that I think I haven't covered. And I was thinking to myself, what would I say if I were to describe Topol in 3 words? I would say awesome. I would say exhilarating. And I would just say transformative. And that will be it for me.